Are you popping too many pills for low back related issues? My name is Dr. Grant Elliott, here to talk to you about opioid addiction and low back pain, and how this unfortunately has become a very, very real and very serious situation. And I want to give you a first-hand experience of an individual that I was working with, actually numerous individuals that I've worked with and spoken with. And I want to talk to you about how this can really confuse individuals, surgeons, other doctors, and how this can take low back issues, magnify them, and actually make them much worse. So here's a scenario I want to paint for you, okay? You hurt your low back. You're not sure what to do. Many individuals go to their primary for this who aren't exactly trained in musculoskeletal issues, especially not low back issues. And they just want to help. They just want to help you get out of pain. So they prescribe you an opioid, a painkiller. But unfortunately, our country, especially the US, has found itself in an opioid epidemic that's very real and is taking many, many lives every day. So you take the opioid because that's what your doctor gave you, right? You're just trying to get better. You're trying to follow instructions and do what you're told, and that's totally fine. That is absolutely fine. You're the patient, but you start to take this opioid, and maybe it helps. Initially, it might help some, right? Kind of numb the pain a little bit, of course, because that's what opioids do. They're just a Band-Aid to kind of numb things. Let's say, though, that your back naturally heals with time. You go and you get rehab, you enter a rehab program, you get back to exercise, and whatever low back issue you had is actually recovered. It has recovered, but you are still taking the opioid. Well, guess what? No matter who you are, whether you like it or not, your brain is going to develop an addiction to this. It will develop an addiction. And here's what can happen. This is a bad situation to be in. You feel better, but as soon as you stop taking the opioid, your pain comes back. And what you believe is that, oh, that's the pain that I've been masking this whole time. That must be how much pain I'm actually in, because I stopped taking my painkiller, and now I'm in all this pain, I'm in all this low back pain. Wow, my low back must actually be really bad. I guess I do need that injection. I guess I do need that surgery. I talk to my surgeons that say, hey, you know what, I got off that painkiller for a week and now I'm in really bad pain. And they're thinking, oh, yeah, so the low back probably isn't healed. We should probably operate on this. This is a real situation that happens all of the time and is wrong. What is actually happening is this: your brain has developed an addiction. It wants you to take that pill. It wants that release. It wants that crutch. As soon as you deprive your brain of that opioid, it recreates the pain. It produces it to get you to take that pill. It's not that your back is damaged. Remember, hurt doesn't equal harm. It's not that your low back is damaged. It's not that your low back is injured and that you actually have a low back problem. It is your brain creating the sensation of pain to get you to take the drug. This confuses so many individuals. It creates nasty situations between patients and their doctors and their surgeons because it causes all of this confusion, and often it leads to individuals getting that surgery because they believe, and their doctors unfortunately believe also, that pain they're experiencing is real biological pain, and that's not the case. It's addictive pain, and guess what? If they go into that surgery addicted to opioids, feeling pain, they're going to go out of that surgery addicted to opioids and feeling pain. They will feel the same after they have the surgery. So you could avoid surgery, you could get out of pain if you purely focused on tapering off of your medication. So I'm not here telling you to do this. I'm advising you to consult with a conservative pain management doctor, someone who understands these kinds of approaches and is willing to work with you to help you slowly taper off these addictive and life-altering medications, these nasty opioids that can cause really bad situations for a lot of people. So I just wanted to share this experience with you. I wanted to share this story with you so that if you have been told you should get on opioids, if that's what your doctor's trying to prescribe you, or if you have friends or family that are struggling with low back issues and are also taking medication, that them getting off the medication is just as, if not more important than them actually doing something about their low back in the first place, entering a proper rehab program that's structured for them, that's based on their needs and based on their goals, and having a cohesive approach between both sides. Otherwise, if one of them's missing, it can lead down a road of pain, it can lead down a road of suffering, it can lead down a road of lifelong disability. And I do not want that to be you. So please share this message, get this out to someone that needs it, and let's continue to spread this message of empowerment, movement, and let's fix our low back.